好，我叫唐思佳，我很荣幸来到这里。Hello everyone, my name is Shirley. I'm the co-founder of Stepsand. I'm here today to talk about physical rehabilitation in China. I'd like to start off with the pain. And in this case, I'm talking about actual pain. Musculoskeletal disorder describe a variety of conditions that affects the muscles, bones, and joints. And that's the numbers in the US. In the US alone, 108 million people are affected annually. That's 1 in 3 people. They miss out 187 work days, and they go to 97 million doctor visits. So, worldwide, 1 in 3 people suffer from musculoskeletal disorders. Statistically speaking, it means that 1 in 3 people in this room suffer from some kind of pain that is affecting their daily lives. Now, not only 1 in 3 people is less healthy, less happy, and less independent, they are also a huge burden on the economy. In the US, they cost the economy annually almost $1 billion. While it's hard to achieve accurate data from China, and just to get a rough idea of the numbers, try to multiply these numbers by 4. It's huge. Let's take a look at the rehabilitation professional to population ratio worldwide. In Israel, my hometown, 1 rehabilitation professional treats 1,777 people. In the US, a bit better, 1,693. The European Union are the big winners with 768 people. Any of you know the numbers in China? Can you guess? Wild guesses, anyone? In China, 1 rehabilitation professional treats more than 217,000 people. That's more than 283 times more than in the European Union. Some more stats about rehabilitation in China. We all love numbers, right? So in China, there are 52,000 rehab beds. That's around 1% of the total hospital beds. Among 60 patients who will need a hospital care, only 1 will get it. Half of the cities in China don't have a rehab facility. But you know what strikes me the most is the per person annual expenditure on rehab. In China it's 15 yuan, and in the US it's $80. So, the demand is high and the supply is low, and it makes the need quite clear. There is an extremely limited or no access to rehabilitation services in China. That means that people who suffer from some kind of chronic pains or try to recover from an injury or surgery simply cannot go back to their normal routine of, let's say, trips to the beach, driving to work, or even playing with their kids. China has a huge gap to bridge in rehabilitation, and she has to do it quickly. Luckily, it's starting to change. Following rapid urbanization, the rise of the middle class, and higher health awareness, in 2002, the government declared that by 2015, basic rehabilitation should be accessed by all. 2008, following the lack of ability to treat the Sichuan earthquake victims and hosting the Olympics, the first physical therapy started at the Beijing Capital University. 2016, industry is booming, more than 200 programs. But only 9 of them reach international standards. So, not only that today, 2015, there are not enough rehabilitation professionals, but their training is just not good enough. We are here to change that. Imagine that each hospital in China could expand their reach so rehabilitation could be available for anyone, anytime, and anywhere. That's our goal. Imagine that the Chinese rehab professionals could enjoy the knowledge, the expertise of some of the top rehabilitation experts in Israel and do it automatically. That's our goal. We're Stepsand. Stepsand is a mobile platform which allows rehabilitation professionals engaging, monitored, professional rehabilitation from afar. Are you curious to know how it works? So right here on the left is our pool of rehabilitation experts from Israel. Dr. Chung, he is a rehabilitation professional, and Mr. Liu is a patient. In between, it's the practitioner app and the patient's app facilitating the process. Let's start. The first stage would be recommended treatment. We developed a deep learning algorithm that learns and analyzes our rehabilitation experts from Ichilov. Ultimately, it can recommend which treatment works best for which profile of patients. The next step is the practitioner app. During Dr. Chang and Mr. Liu's first meeting, Dr. Chang will enter Mr. Liu details to the system. The system then creates a smart exercise list based on similar patients. Dr. Chang can now further adapt the treatment to Mr. Liu's specific needs. The third step is the patient app. I'm very happy and excited to finally introduce to you Andy, or the Chinese version, Andy. Andy will take this boring treatment that you saw before and will make them fun. He will turn them into a chat-like experience. How many of you are using WeChat? QQ. What's up? Okay, I think we got the picture. Chat is the way we interact today. Companies such as Facebook, WeChat, Slack understand that and have today an open API for bot creation. Back to Andy. Andy will guide Mr. Liu at home through our own created video content. He will remind him to exercise and will even give him the motivation boost when he needs one. Our patients simply love Andy. Although they know he's virtual, they will sometimes write back to him things like, Andy, I'm so sorry I couldn't exercise tonight. I have a wedding to go to. And Andy will write back, he will say, don't worry, tomorrow is a new day. The next step is back to the practitioner. Dr. Chan now receives actionable information about Mr. Liu's status. It means he's being informed only when there is a need. The feedback loop closes when Dr. Chang and Mr. Liu's performance is back to our database. As more and more patients and more rehabilitation professionals will use our system, its recommendation will get better. We are actually getting better all the time. Our business model. Because we allow rehabilitation facilities to have more patients, we're actually a revenue generator for them. Our business model is a monthly subscription fee based on the number of patients and paid by the rehab facilities. In order to minimize risk for our clients, we created a win-win business model. When our clients grow, we grow with them. Our go-to-market strategy is divided by 3. The first starting point goal will be to establish key partnerships in the Chinese market. We will do it with partnering with local agents and with local clinics. Our mid-term goal would be growth. We will then address hospital chains and insurance companies in order to grow quickly. In addition, we plan to integrate with local EMRs in order to create an additional distribution channel. Our long-term goal is to allow rehabilitation to anyone at any time and anywhere. So, in addition to our B2B service, we will create an AI-driven B2C app. The app will address patients who cannot make it to the healthcare facilities. Our business model at this point would be selling the big data we have on our patients to payers. Where are we at today? We're currently working with some of the largest organizations in Israel. Among them are the Tel Aviv Sourasky Medical Center, which is one of the top 3 hospitals in Israel. The Sourasky Hospital is a strategic partner and he is the first paying client. Working with the Sourasky Hospital from very initial stages allowed us first to create a product who really fits both patients and rehabilitation professionals. Second, it allows us to have an ongoing validation of our assumptions in clinical trial. And last but not least, Stepsand is so much more than a learning algorithm. We deliver the Israeli know-how to the Chinese healthcare facilities. We are very excited to be doing a pilot with the Israeli military. And in addition, we are currently raising our seed round in order to establish ourselves in the market and further develop our product. That's us. Tomer Weinstein is our CEO. Tomer is an experienced entrepreneur. His last startup was also in the digital health field. Tomer holds an MBA from the University of Geneva. Elad Amsalem is our CDO. Elad is an alumni of an elite intelligence unit of the Israeli IDF, where he managed dozens of the developers. Next is Professor Israel Dudkiewicz. Professor Dudkiewicz is our medical advisor. He is the head of the rehabilitation department in the Sourasky Hospital. Our business guy, Scott Pally. Scott, in the last 15 years, founded and sold 2 companies in the field of security. Myself, Shirley Baumer, I'm the head of product and design here at Stepsand. I'm also an alumni of an elite intelligence unit, and in addition, I'm a big China fan. I spent 3 years studying both China history and culture in the Hebrew University of Jerusalem and in the Jilin Dashue in Changchun. 非常感谢你的关注. Thank you all for listening.